Have you ever had that weird, kind of unsettling feeling of fluid coming out of your ear? You're not alone. It's actually way more common than you'd think, but it can definitely be a little alarming. So in this explainer, we're going to decode what exactly your body might be trying to tell you when this happens.
Let's just dive right in. I want you to think of ear discharge, not as just some random, annoying symptom, but as a message, a direct signal from your body that something's up. And our job today? It's to learn how to read that signal.
All right, so to kick off our investigation, let's get on the same page. First things first, what exactly is ear discharge?
Well, it's pretty much what it sounds like. You might hear the fancy medical term otorrhea, but all it means is any kind of fluid that makes its way out of your ear. We're talking water, we're talking pus, sometimes even blood. And its appearance, is it thin and clear? Is it thick and cloudy? Does it have a smell? That is our very first clue to figuring out what's really going on inside.
Okay, let's break this down a bit more, because the details matter. If what you're seeing is a clear, watery fluid, that's often a sign of a minor infection or maybe even an allergy. But if you see thick, cloudy pus, that's a huge red flag pointing to a bacterial infection. And then there's blood, which could mean there's been an injury somewhere inside or that you're dealing with a more severe infection. So the big takeaway here is that what the discharge looks like tells you a lot.
All right, so now we know what it is, but the bigger question is, why is it happening? Let's take a look at some of the most common culprits behind ear discharge.
The number one reason by a long shot is an ear infection. But it's not the only one. A ruptured eardrum can cause fluid to leak out. And of course, there's the classic swimmer's ear, which happens when trapped water basically becomes a perfect little breeding ground for germs. Now, pay close attention to that fourth point, injury from things like cotton swabs. This is a huge deal, and we are definitely going to circle back to it. And finally, you could even be dealing with a fungal infection, which often has its own unique signs like intense itching.
And this brings us to a massive myth we need to bust. We're so often told to clean our ears to get rid of all that wax. But here's the thing. Earwax is not the enemy. It's actually this incredible built-in defense system. It's naturally antibacterial, and it's sticky. It's like flypaper for dust and dirt. When you aggressively clean it all out, you're actually leaving your ears totally defenseless.
Now, ear discharge rarely shows up to the party alone. It almost always brings along some other symptoms. Paying attention to these gives us a much clearer picture of what we're dealing with.
So along with the discharge, you might feel pain or just a heavy, full sensation in your ear. It's also really common for sounds to seem muffled. You might notice a bad smell or that itching we talked about, which can be a clue for a fungal issue. And if an infection gets really bad, you could even get a fever. In some of the more serious cases, it can even cause dizziness or vertigo, which is a sign that the infection is messing with your inner ear's balance system.
Okay, so you've got some of these symptoms. What can you do right now, safely, from your own home? Let's walk through some of the immediate steps you can take.
But before we even get into what you should do, we have to talk about what you should absolutely, positively not do. This is the golden rule, folks. Do not put anything inside your ear canal. I'm talking cotton swabs, bobby pins, your keys, anything. All you're going to do is risk pushing a blockage deeper, introducing new germs, or even puncturing your eardrum. Just don't do it.
So, what can you do? It's really simple. 3 things. Number 1, keep that ear dry. When you shower, you can use a cotton ball with a little petroleum jelly on it to act as a barrier. Number 2, a warm compress held over the ear can feel amazing and really help with the pain. And number 3, you can and should gently wipe away any discharge on the outside of your ear. But again, and I can't say this enough, don't go digging inside.
Now, home care is great for managing the symptoms, but it is not a cure. And this brings us to what is easily the most important part of this entire conversation, knowing when it's time to stop trying to handle it yourself and call in a professional.
Look, trying to diagnose this yourself is just a bad idea. Why? Because you can't see inside your own ear. A doctor has the special tools to look in there, to see if your eardrum is okay and to figure out the root cause. Is it bacterial, fungal, an injury? Getting the diagnosis right is absolutely everything, because without it, you can't get the right treatment.
And if you need a perfect example of why a professional diagnosis is so critical, this is it. Let's say you have some leftover ear drops in your medicine cabinet. Well, look at this. Ofloxacin is a common antibiotic drop, and it's safe to use even if you have a ruptured eardrum. But gentamicin, another antibiotic, is absolutely not safe in that situation. In fact, it can cause permanent hearing damage. This is exactly why you cannot play guessing games with medication for your ears.
So when you see a doctor, they're going to tailor the treatment to your specific problem. They might give you antibiotic drops to kill bacteria, or maybe some steroid drops to bring down swelling. If the infection is really bad, they might even put you on oral antibiotics. And, of course, they can guide you on the best and safest pain relievers to use.
So if you remember just one thing from our chat today, please let it be this. When it comes to something as precious as your hearing, guessing is just not an option. Trying to treat it yourself can be genuinely dangerous. The smartest, safest, and most effective thing you can do is always talk to a healthcare professional.
You know, it's funny. We use our ears every single day, every moment, to listen to the world around us. But maybe this is a good reminder that every once in a while, we need to take a moment and actually listen to our ears. They just might be sending you a message that you really need to hear.